This is our presentation on Staphylococcus infection. Staphylococcus aureus is the causative agent of staph infections and other diseases, such as pneumonia, and infective endocarditis, and food poisonings. It is a gram-positive bacteria, which means it will stain purple with a gram stain and is cockeye-shaped. They are arranged in grape-like clusters and are facultative organisms, meaning they can grow aerobically and anaerobically. They tend to live in temperatures between 18 degrees Celsius and 40 degrees Celsius. This disease is acquired by direct skin-to-skin contact or by touching a contaminated object or surface. The best example of this would be towels, desks, blankets, utensils, and it can enter the body through cuts and wounds on the skin or mucous membrane. Poor hygiene is a major environmental factor that affects how people get this disease. Because if people do not wash their hands, the bacteria will stay on their hands and contaminate other surfaces and other people.
Staph can cause several types of infection, but skin infection is the most common type. And if skin infection is not properly treated, it can lead to more invasive types of infection like bone infections, endocarditis, food poisoning, pneumonia, and toxic shock syndrome. MRSA is an antibiotic-resistant strain of staph that's become more common due to the overuse of antibiotics. And the incubation period for staph is usually 4 to 10 days, but it's hard to determine because staph is so common on skin. Because of the many types of staph infections, signs and symptoms greatly vary. For a skin infection, it's common to see boils, cellulitis, and impetigo. For bone infection, you can see pain, swelling, warmth, redness, fever, and chills. For endocarditis, there's fever, chills, fatigue, rapid heartbeat, shortness of breath, and edema. For food poisoning, nausea, vomiting, diarrhea, and low blood pressure. For pneumonia, high fever, chills, cough, chest pain, and shortness of breath. And for toxic shock syndrome, there's high fever, nausea, vomiting, rash on your palms and soles, confusion, muscle aches, diarrhea, and abdominal pain. If it's suspected that the patient has MRSA, food poisoning, or toxic shock syndrome, cultures of blood and tissue will be taken. Skin lesions will also be inspected.
Severity of Staphylococcus infection. Staph infections can turn deadly if the bacteria invade deeper into your body, entering your bloodstream, joints, bones, lungs, or heart. A growing number of otherwise healthy people are developing life-threatening staph infections. Treatment of Staphylococcus infection. Treatment usually involves antibiotics and drainage of the infected area. However, some staph infections no longer respond to common antibiotics, also known as antibiotic resistance. Vancomycin increasingly is required to treat serious staph infections because so many strains of staph bacteria have become resistant to other traditional medicines. But vancomycin and some other antibiotics have to be given intravenously. Device removal. If your infection involves a device or prosthetic, prompt removal of the device is needed. For some devices, removal might require surgery. New research. There's research looking at the RNA molecules in regard to its stages of growth and virulence, which will in turn make the bacteria's machinery vulnerable. They observed RNase P, a component of mRNA degradation, and discovered a compound called RNPA1000 that inhibited the bacteria's enzyme ability by 50%. Researchers used this compound on S. aureus infected rats, and it saved the lives of up to half the animals. However, it proved to be too toxic once tested on humans, so further research is being done to find related compounds that are more effective but less toxic to humans. A couple interesting facts about staph infection are many people carry S. aureus and even antibiotic-resistant variants such as methicillin multi-resistant Staphylococcus aureus MRSA, a superbug, on their skin and mucous membranes. Up to 20% of the human population may be a carrier of this bacteria. It is one of the most common causes of hospital-acquired infections and is one of the 5 most common causes of infection after injury and surgery. And here are our sources.